Ready?
Yep.
Okay, we just want to show you how to hook up the surgical option on the CTS today. So I'm going to show you the connections from the back of the unit and how to do that. So the first thing you want to do is get your surgical fiber out, and I've already got this through the handpiece. The handpiece is steam sterilizable. The fiber is only gas sterilizable, so you need to manage that accordingly. The fiber fits through the end of this handpiece, and you can see it comes in and out a certain distance. I usually like to have it about a ½ an inch protruding from the tip, and then screw down the end of the handpiece, and that'll lock it in place. And the end piece has the fiber has a cap on it, and what I'm going to do here is when I detach the fiber from the laser, I'm going to transfer the cap from this to the end of the laser fiber. So I unplug the finger switch. I'm going to unscrew the therapy fiber piece, pull it straight out, hold both in my hand. I pull the cap off of one and I put it on the other. So I want to keep that covered at all times. Then I set that down, and now I'm going to insert the surgical fiber and twist that in until it's finger tight. Okay? The other connection that I need to make at the back of the machine is the foot switch. So what I'm going to do here is connect the foot switch, and that's what this elevated metal port is. And you'll see there's a little notch in the foot switch you must line up to get it to insert properly. And there's sort of a locking collar with a nub on it, and that locks in. So what I'm going to do now is turn the laser around. Now that you've seen those two connections on the back of it, I'm just going to put my fiber out of harm's way over here, the therapy fiber. And what you'll notice on the front of the laser is that from the operation mode, we now have a surgery mode, and the protocol mode has been turned off. What I want to show you on the foot switch is a lot of people confuse is this, they're saying, oh, my foot switch isn't working. But the reason is this is the cover of the foot switch, and the actual foot switch itself is inside this cover, okay? And then what we want to do is we press our surgery button when we're ready for surgery, and it defaults to this 10-watt setting. Typically, I condition the fiber while it's on that 10-watt setting, and you can see I have my safety glasses on. And to condition the fiber, you just need a tongue depressor with some black marks on it. Okay, so we're going to put the foot switch on the floor. I'm going to open up the foot switch guard, and then I'm going to take my tongue depressor. Okay, so now we're ready to condition the end of the fiber, and the way we do that is we go to the surgery mode on here. It's going to default to 10 watts. Most of our surgery is going to be at 2 to 3 watts, but for conditioning we can do it at 10 watts. Hit the standby button. It's going to blink several times. And what I'm going to do is, first thing I'm going to check that I'm making a perfect circle. That means my fiber has been well cleaved. I'm going to touch the tongue depressor and then fire the laser for just a second. Once I've done that 3 times, I've carbonized the end of the tip, and I'm ready to do my surgery with it at that point. Again, most of the time on surgery you're going to be down around 2 or 2.5 watts. You want to be touching the tissue and only activating the laser for 2 or 3 seconds at a time. It's really good to practice on, say, a green pepper, a bell pepper, or a piece of chicken, some kind of meat, to get a feel for it before you use it on live tissue. There's a lot more extensive training available through the AIMLA site. There's 4 surgery modules under the AIMLA training, so I recommend you do that. This is more or less just to show you how to connect the laser and get it ready to go. I do also want to show you the other parts of the kit. There's basically a wire stripper that allows you to strip little pieces of this blue coating. It's like a wire. The fiber is covered with a blue coating, and the wire stripper allows you to do that. And then there's a pen that looks like a Sharpie in the kit, and that is actually a diamond cutter. And what you want to do after you use this each time is cleave off a small piece. So this is just to make a scratch in the end. break off the end, and again to test whether you've done a good job of cleaving the fiber, you just aim the beam onto your tongue depressor, and as long as it's a perfect circle, you're fine. If it's misshapen, then you want to re-cleave it and break off another piece. So the fiber is quite long. You have a lot of uses in each fiber before you have to buy a new one. They are available through the clinician's court on the website if you need it. But those are all the ingredients of the surgery kit and how to connect it. When you're done, hit the ready button, you go back into standby mode, and then you're ready to disconnect from the laser. Okay. All right, here we go. So this is a little summary and recall of what we've already been through in the training. I want to go over a couple of points first. One, as far as the cable goes, you can keep it wound up on the tray, but typically I have it unwound all the way. The way the cable is wound here, that is approximately the maximum bending radius of the cable. So remember, this is a fiber optic cable, and you could break the fibers if you really crush that at an acute angle. So again, this bending radius that wraps around the holder is about the maximum that you want to bend the cable at. I also want to talk a little bit about the patient tracker if you have that function on your computer. So I'm just going to look up a patient on here. I'm going to look up all of my patients, and I'm going to bring one of my patients up here because one thing that we didn't talk about, let's look at the treatment view here. One of the things we didn't talk about was how to get the records onto a USB drive. So what happens is you plug the thumb drive into the back of the laser, and then when you're looking at the record, if you want to export it, you can hit this print records button. So it's a little counterintuitive that exporting the record, we hit print record, and then we have a choice of print a general report or print a detailed report. So again, you can choose which one you want, and what's going to happen is it tells you that it's successfully exported your record. Then you can unplug your USB and take it to your medical record system and download that PDF file into your computer. So again, some people want to know how to export the record from there, and you hit the print button once you have the USB plugged into the back of the computer, and that will do it for you. Again, let's just talk about quickly the summary of what we want to do when we're treating. So remember, we're moving at 1 to 3 inches per second. When we're in non-contact, we're 1 to 3 inches away. We're moving in a grid-like pattern, so we're getting even distribution of the laser light. We're keeping the probe head perpendicular to the tissue at all times. That, again, goes with the physics a little bit more. We're trying to treat the joint from 360 degrees around whenever possible. Of course, when you're doing the back, you can't really get from 360 degrees, so on a back, concentrate on 270 degrees. But again, trying to get it from all different angles. You want to take the joint or the anatomy through a range of motion, so try to have it in at least 2 different positions during the treatment. If you can get into more than 2 different positions, that's great. And try to use the contact head whenever possible. So when you cannot see the lesion you're treating, if it's a deep lesion, use the contact head. You'll get 60% less reflection of the light. You get more effective treatment and dosing of the tissue if you do that. So those are the main treatment principles. Remember, with your iPad, to use all 3 functions on the iPad, the laser liaison, just explore through there. I use mostly the staff tab on there, the staff training tab, and then also use the iBooks and then the iPhoto and the camera function on the iPad as well. So that is a quick little finish up and summary of what the laser does. You should have all these things explained more fully in the earlier videos, but those are the take-home messages. So thank you again.